Hi everyone, Oliver Armstrong here. How do you know when you've done enough therapy? The answer is quite simple. Do you feel different or do you feel the same? When you think of the past memories, whether they were severely traumatic or they were just problems for you, when you think of them, do you still feel the unwanted emotions? If you do, then the therapy hasn't done its job or you haven't had enough. It's really that simple. Now, one caveat being, traditional talk therapies like counseling and psychology, a lot of the time they're not going to really be able to help you change how you feel. They're great for venting and talking your problems through and a whole bunch of other things, but generally they don't help you heal. They don't change how you feel. So if you've talked about your problem a lot and you still feel that way, perhaps you need to shift into an alternative therapy. But with my approach, utilizing conversational hypnotherapy, the way I have my clients know whether they've done enough therapy, and I don't tell them, they tell me, because I don't know what they are feeling. So I ask them, do you feel that your problem is different now? Does it feel neutral, much like when you imagine your bathroom door? How does it make you feel? Kind of not one way or the other. Does your problem feel that way? Yeah, it kind of does. Then that problem has been resolved. It's that simple, right? At least with my approach. So that's the quickest way to know if you have done enough therapy. If you still feel any emotions that are unwanted or are negative or are impacting you or are painful, then you haven't resolved what needed to be resolved. And you either need to continue with the therapy, or like I said, if it's a talk therapy that you're doing and you've done it for a while, perhaps it's time to look at an alternative therapy such as traditional hypnotherapy or conversational hypnotherapy such as the approach I utilize, or one of the other amazing alternative therapies which exist out there. Hope this has helped.